Hello, my name is Kyle Harvey. I'm currently studying health sciences at the University of Central Florida, and I'm currently applying to dental school. During my spring semester, finishing up was definitely a little bit of a challenge. At first, we were entering spring break, and that's when we first kind of got the notice that courses are going to be transitioned online. And what I figured was the biggest adaptation was that a lot of students and a lot of faculty kind of had the mindset that this might have been temporary because at first it was only a 2-week pause until classes resumed. And so a lot of professors had that mindset to finish up courses in person. So for my physics lecture especially, there's a lot of demonstrations that go to that to demonstrate concepts. And that was a very big transition because we wanted to have those in person. And I think that's where sort of the struggle was, because as we finished up those 2 weeks, we got the final notice that the rest of the course was online. So we kind of got that wave twice where courses now are being transitioned online. So how do we administrate the best education that we can in those 2 weeks to then, okay, now the rest of the semester is online. What are we going to do now? So that was definitely the biggest adaptation. But other than that, I believe students and the faculty, we finished the spring semester pretty strongly. For me personally, since I had taken the DAT the summer before COVID happened, I felt more confident in applying this cycle. So if I was in a different position and I would still be studying for the DAT, I believe my decision may have been changed because I just know from my peers and my fellow pre-dental students that scheduling, canceling, postponing exams has been a nightmare for a lot of my friends and peers. And so my sympathy and empathy goes out to them. But since I had a lot of those things in order, I definitely felt more confident to apply this cycle. But a lot of the resources that I wish I would have had, like going into the PHPL office, scheduling assistance with personal statements and more in-person mock interviews, those definitely I had to really think about, is that really what I want to use to apply stronger the next cycle? Or again, can I adapt through this and just put my strong foot forward? And so after careful thinking, I definitely made the decision to apply this cycle. For resources like those, with mock interviews and personal statements, at first it was definitely challenging. The offices were just cram-packed. They couldn't really respond back, and there was just very little communication. So because of that, I had to use other revenues. So I actually asked my English professor, I asked peers that are actually in dental school, and I had to just think of new ways that I can ask and to get people to revise and to just look over my application through different perspectives. So at the end of the day, it would have been very helpful, very useful, because I know the University of Central Florida offers many, many resources, as well as our pre-dental club at UCF offers many, many resources in crafting, peer editing, and just helping each other through the application process. So having that distance between all of us definitely had to make me adapt to more individualistic way of applying. But at the end of the day, it kind of made it my own, where I had to be very truthful to myself and couldn't rely so much on the help of others, and had to be true to what I was applying with. So at the end of the day, we all adapted, and it was a really good process. Yes, definitely at first. My biggest concern with how faculty at those universities were handling the pandemic, my biggest concern was manual skill sets for the students to learn. Because I know during the first years, simulation labs and waxing labs, those are a very big part in developing critical hand skills for current dental students. So my biggest concern was, how are the universities managing that? How are they giving quality education to their students, and how is it handled if it's handled completely virtually, how is that being handled? Like, those are my biggest concerns as applying to dental school, is if the whole education is online, how am I getting those hand skills that I need to better my future? And if not, what is being set on the side for me to practice at home. And through more research and by just contacting a lot of contacts that I know that are in dental school, I've had more reassurance that every university that I've heard of is really taking the proper precautions to give their students quality education. Applying in this cycle has definitely been a big adaptation again for preparing for virtual interviews. There are lots of cues that are very different than applying or interviewing in person, like applying and interviewing virtually, looking at cameras instead of people, like angling, how the room is set up. Like, I wish I could be in a setting that's more professional, but this is how I have to adapt. And currently I live with five other college students, so coordinating with them to just get the noise down to make sure that there's no distractions present. So there's a lot more variables to an interview. There's a lot, just like scheduling this interview, I have to coordinate with every person that lives here saying, please respect this 1 hour that I have or more, and so that I can give my full attention, not have banging on the door or anything. So there's a lot more undesirable elements to a virtual interview than I would like to have, and the decision of whether or not going home is a better option than at home. I have 3 very noisy dogs, so it all has their challenges. So it's like anything, like the whole motto this year, how well can we adapt to it? And at the end of the day, we just do the best we can. So. Making that final decision to apply, I definitely had a lot of conversations with family and friends of whether or not to pursue this, and majority of them were very supportive in my decision, because at the end of the day, dentistry, oral health, it is contributable to our overall health, and it's a profession that's not going anywhere. It's very beneficial in giving preventative medicine as well as immediate care. So majority of friends and family, they're very supportive, and I felt really reassured in my decision to continue on. Definitely the impact of my family's occupations was troublesome, to say the least. On my mother's side, as a school nurse, she had to work a lot more hours, a lot more schools. And since the nurses are nationwide, always short-staffed, she had to contribute more of her part to give the schools in her district more care. And then my father, on the other hand, trying to build a business, definitely had some setbacks with consulting live people. Like, it's very hard and difficult to reach people one-on-one in the midst of a pandemic. So as any father or mother to their child, they want to care for them and provide for them and to send them off to education. So I knew in their hearts that they wanted so deeply to provide for me and to give me that opportunity. So I know at the end of the day, they're both doing everything they can to support me, and I felt that emotional burden that they were struggling with that very deeply. And it was a lot of effort to not think of that so much, to just know that as long as you try your hardest, as long as you put in the effort, that these things will work itself out. And that's kind of how my family's been taking the step in all this, is just work your hardest and be okay with end results if you put in all your effort. The transition to fall semester has really been really easy to follow. I believe from the really quick and sudden adjustment from spring semester, and then kind of learning from any successes or failures, transition to summer semester. And the summer semester was delivered also very well, but when it came time to go to fall semester, I believe everything was worked out. The professors and students got a really good grasp on how to handle a virtual format, and everyone was just more prepared. And it was definitely a more seamless transition. There was a big concern for how classes were delivered online versus Passfail, just how they're viewed as an admissions board. I always tried to keep that perspective, is not how am I viewing my grades, but how would somebody else view my grades. And during the spring semester, we were all encouraged, but also had the option to take Passfail if we needed it, because spring was definitely a bigger adaptation than any other semester that we've had here. But through all that, I had recommendations from all my current dental student friends and all my friends that were applying at that time to, if you have the option, take the letter grade. And I believe all schools kind of encourage that, to offer a letter grade if that's what you can do. And I know there's some schools that maybe didn't have an option, maybe had to do pass-fail, and which is also troubling to see how admissions board would view that, if they would give like the time for an explanation, or if there needs to be an explanation. That's something that's questionable to me as an applicant, is how is that really viewed as an administrator, as a admissions officer? I want to know, like, if I take a pass-fail, is that just viewed as just simply obtaining a C or something? And that very may well be the case. And I definitely want to do my part in preparing for that as best as I can, but definitely I've sought advice from others, and I knew that throughout the courses that I wanted to, if I could, get a letter grade, and unfortunately I've gotten a letter grade for all my courses, and I was able to finish up very well. Yeah, definitely my family had a role in me pursuing dentistry as a career. At first, they assumed, since I was so interested in just the medical field in general, that I would pursue medicine, to just become a physician, a medical doctor. But through my personal life experiences, I was just more attracted to dentistry. I was more attracted to the patient interaction, the ability to use my hands in a very precise manner. And all those kind of elements brought me closer to dentistry and further from the medical field. And when I told them about that, they kind of realized that all of the hobbies that I've done my whole life, like cooking, playing piano, or anything, like, they kind of realized they were all coming together as like a clear picture that, yeah, dentistry would actually be a great fit for him. And they definitely got more understanding of that, because it is difficult applying like first generation, like first member of my family, because on my father's side, every single person is an engineer. So I come from a very, very long line, from like my great grandfather down to my brother. And so when I was in high school, or choosing to go to college, a lot of my family members assumed that I'll take the engineering path. And that was definitely not on my radar at all. So all of them were very supportive in my decision to pursue dentistry, and I was very fortunate for that. From my experience applying in a pandemic versus the experiences I know of my peers that did not have to apply during a pandemic, is either way, it's going to be a hard and daunting process. Either way, you need to put your best foot forward and give everything you have. In life, we're always going to have struggles. We're always going to have to adapt. We're always going to have to handle things in a way that we might have never have planned. And I believe, as bad as the pandemic has been, it's been a very harsh reality, learning to adapt through this. And it's caused everybody to adapt, to see things through a new perspective, and how you can handle that, how you can adjust to it, and how you're able to change what you might have been very routine into a whole new strategy to apply in these new circumstances. So anybody who's applying in the future, just try your hardest, put your best foot forward. It's going to be okay. You're going to do the best you can, and the admissions boards are going to know that. They're going to know that. How have you been researching dentistry on your own? How have you been showing your passion? And I believe that's very important, that if you want something bad enough, at the end of the day, you're going to do everything you can to accomplish that. And I don't think that should be a reason to stop a dream if that's your dream. You can't let, even as big as a pandemic, stop you from pursuing what you were meant to pursue. So to anybody applying in the future, just give it your all, and it's all going to work out in the end of the day.